Hi friends, I'm Dr. Kaushik, andrologist who is specialized in males health and especially in penile implant surgery. So right now we are one of the highest volume implant surgeons in India. So today I'm going to address a series of questions which are commonly asked by the patients to me regarding penile implant surgery. So we will be putting a series of videos regarding this questions which are commonly arising in the people's mind. So, the first thing the patients usually ask to me is, am I the right candidate for a penile implant surgery? So, the answer is very simple. So, if you are having erectile dysfunction and if you are not responding to that pills like Viagra or else you are having side effects to the pills, then you are the candidate for the penile implant surgery. So, certain patients they will be happy with the medications so they can prolong their sexual activity with the medications, but when the medications are not working or when you are having a tremendous side effects like headache or low backache or other side effects like gastric irritation, then you are if you are not satisfied with the medication and you have to wait for half an hour till the medication kicks in, and if you are not satisfied with that timing or you are not able to have a spontaneous sexual activity when you and your partner decides, then you can go for the best option of penile implant surgery. So first of all we should understand the most commonly told myth. So penile implant is the last resort for sexual erectile dysfunction. This is not true. Penile implant is the best resort for the erectile dysfunction. So this is one of the best and the long lasting solution for erectile dysfunction. So there are other options like vacuum erection devices, intracavernosal injections, intraurethral medications, or P shots or PRP or concentrated growth factors or stem cells, shockwave therapy, like this. So many other options are there. They will give a little improvement for certain type of patients but not for everyone. If a P shot is helpful for you when you are 30, you cannot expect the same result when you are 40 with the same P shot, because the changes happen in the penile artery, so that you require a different solution for the erectile dysfunction. So if you have erectile dysfunction and if you are not satisfied with the pills, then you are the right candidate for a implant surgery if you want the best solution for erectile dysfunction. So I want to tell you whether any other conditions can block a penile implant surgery. So you can clearly understand that whether you are diabetic or hypertensive or you had an open heart surgery or you had a prostate carcinoma or any renal diseases or any other medical morbidities, you are eligible for a penile implant surgery, because this is a very minimally invasive surgery which can be done to any of the patients for a penile implant for to this can be done to any of the patients to treat their erectile dysfunction. So the second question most commonly patients used to ask me is, which type of implant it suits me. So this is an interesting part. So as a high volume penile implant surgeon, I would always want you and your partner to have the most satisfactory and natural erectile feeling which you used to get when you are young. So this is a teamwork which involves the penile implant surgeon and the patient and if possible their spouse, so that we can clearly come into a conclusion. So first let me tell you what are the implants which are available in our market. So there are two categories. One is the semi-rigid penile implants or the malleable penile implants, and the second option is the inflatable penile implants. So in the semi-rigid category, this is a cost-effective way and it has many models which are available in India. So if you are looking for a very good sexual activity without the need of any concealability, it means if you are not much worried about the concealability, if you wear a jippa or something which can hide your penile area, so that you can go for the Indian implant, which is the cheapest and it has a very good result in sexual activity. So if you want a concealability, then we have to go for the imported implants There are many implants which are available in our market, which includes Tactra, Rigitan, Zephyr, Promodon implant, even the Virilis implant from Italy. So all these implants are available in our market. So when you visit us, we can explain you what are the options we have in these implants, because certain implants are good for diabetic patients because they have a hydrophilic coating. Certain implants, they are having a very good natural feel. So if the patient is very keen on the natural feel, then we can go for that implant. So it is better to discuss with your penile implant surgeon before you go with the surgery in choosing the implant. So if you are coming to the inflatable implants, there are two giants who are in the market for the around past 20 to 30 years. So one is the Boston Scientifics, which produces the AMS, and the next one is the Coloplast implants. So right now, especially in the past 1.5 years, a new competitor has come into the market, which is the Rigicon. So they are also having Rigitan, Rigi Infla and Infla AX, which means we can increase the length and girth. So all these models are available. As an implant surgeon, we are trained to do surgeries with all these implants to give the best results, because the patients come from different areas and different backgrounds. So certain people, they require Boston Scientific implants. So we do that, and we are trained in doing all these surgeries of all the implants. So in the end, what we need is, we need a satisfactory patient partner satisfaction. That's the most important thing, which as an implant surgeon, I feel success when the patient and partner are satisfied. So regarding choosing the implant, these options we can keep in our mind, especially if you are looking for the money. If you are looking for the cost factor, then you can go for the malleable implants. If cost factor does not matters, and if you are ready to spend some money, and if you are looking for the most natural feeling erection, then you can go for the inflatable implants, which are available in different brands. So the next most common question. So almost every patient who comes to me asks me about this question. So what is it? Will I lose my length after the penile implant surgery? So as a high volume surgeon, I always wanted to give the maximum size for your penis in terms of length and girth, because that is what we are trained to do. So any penile implant surgeon, they would like to give you the best possible length and girth. So certain patients come to us and they tell, doctor, when I was in 20s, I had a very good length, but for the past 10 years, like right now I'm 40, for the past 10 years, my erection is also poor and my length is also poor. So you should understand the mechanism behind it. Erectile dysfunction and Peyronie's disease both can reduce your penile length. How? So when you are 20 years old, you are not sexually active. But every night you will have a very good, not one, you will have multiple very good nocturnal erection, and even in the morning you have a good erection. But as the age passes, when you're having some comorbid diseases or anything, or when your stress level is too high, your nocturnal erection is reduced. So obviously your penile length also reduces, because the penile tissue is like a lung tissue. If there is continuous pumping in of blood, it will maintain its length. If there is not pumping in of blood, then the size shrinks. This is what happens, especially in case of our lungs. So for an athletic man, his lung capacity will be much higher compared to a normal sedentary man, because he is using his lungs for the maximum capacity. So when you get multiple erections, or when you are getting a good erection, you should enjoy it, because it will help you to maintain your penile length. So the other condition which can affect your length is Peyronie's disease, which is also treatable at this point. So in case of Peyronie's disease also, you have a chance of losing your penile length. But as a high volume penile implant surgeon, we have certain tricks to enhance your length and girth. So the first point, which is always in our mind, is your satisfaction, which means your visible satisfaction is your length and girth, which we are able to achieve. So we use certain techniques intraoperatively, and even preoperatively also we use certain techniques to get the maximum length. especially the vacuum erection device. If you are using it regularly for a period of 1 month, then we can get a better length after the penile implant surgery, which will be equivalent to your erections which you had at the age of 20 years or even in teenage. So, as an implant surgeon, there is a minimal chance of losing the length. You don't want that to happen. So, to prevent that, we use certain techniques both preoperatively and intraoperatively for you to achieve the best length. So, please follow us for more videos on the common doubts which are asked about the penile implant. Thank you.